Coming up in today's video, watch us remove this white plug from somebody's ear canal. I'll let you guys try and work out what this is, but this is coming up in one of the videos today, so make sure you stay tuned. My name is Rhys Barber. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green, and I'm the other audiologist here. So there's a bit of a mixture in this video. We've got a bit of everything. We've got keratin.
We've got some nice keratin ribbons.
We've got a foreign body. We've got a really narrow ear canal.
It's all that nearly this one, guys.
All tricky cases, actually, quite difficult cases, but luckily came away nicely.
It did. We've got, I have to apologise as well, guys. We've had no videos this week so far. We've been launching a new website. We've had to do some stuff with our emails as well. So I've been super duper busy as well as clinic. And I had a dental appointment as well for this week, so I haven't got a lot done. So basically, yeah, bear with us. We should be back to normal, fingers crossed, this week.
We said
now.
to put a new top on, he's been dribbling. I
couldn't do a voiceover yesterday because I couldn't talk. So I was so numb. So yeah, this is I think they're all my patients in this one today, but this first one, what makes this a little bit more difficult is we've got this really, really hard plug in both sides and a narrow ear canal here as well. So this patient's a little bit older, so you do find that the ear canal starts to sort of, not collapse as such, but it just starts to relax and fold over at the entrance. Yeah. So you're holding part of the ear canal open to get this in. Now this is the Jobson horn going in here, just because it was a bit tough and it couldn't quite pull through the entrance.
That was a lucky one there. I always hate doing those because you never know if it's going to kind of push it in that little bit.
Exactly. Yeah. It's one of those. Weirdly, I was watching one of Connor's videos the other day, and he was talking about the fact that as audiologists, we, and wax removal peoples, we rely a lot on things like microsuction, and we don't use the curettage tools as much. Now, I know you love a curettage tool, you really kind of enjoy it, but he was talking about the potential of us becoming a little bit more sort of de-skilled because we don't use it so often. I think I tend to use, I don't use curettage as much as I used to, but I still tend to still use it quite a bit.
Yeah. It's handy in certain cases, but if it's really soft and squishy, there's nothing you can do with that really.
Exactly. and this is one of the things, I think you need to have all these different ways of removing wax in there. You need to be able to do curettage. You need, I think irrigation is great for softer wax. I know that's a bit, there's no issue with irrigation, but I know some audiologists really like to use it, some audiologists not so fast. And suction, I think, is still a great tool, but we very much judge it on the wax. Like for instance, this is a rock solid wax here, so you probably wouldn't look at irrigating that because it's not really going to come out particularly well and with the entrance to the canal, but suction and curettage are going to work fantastically well for that. So it is using combinations of different methods to get this out.
Excuse me, losing my voice already. I haven't even said anything.
I know, I talked for the last 10 minutes.
I'm losing your voice.
Somebody told me off because I said the other day, I'm not going to say much in this one. I end up talking all the way through it again. So
It's fine. Just so you get to see me, that's all.
That's what it is, yeah.
I'm just here for show.
Taylor's the eye candy.
No.
But it's come away really, really well. We had to use the Jobson horn to pull that through. But a nice plug and lovely and clean beyond it as well.
Yeah, looking nicely.
Spot on there. So that is one, I'm going to go with an inch, because I reckon if we squish that one down a little bit, that would be an inch.
Yeah, depending on how you look at it, just under 3 centimetres, 2.5 if it's all squished in.
Yeah. Guys, don't forget, the new website is now launched, thank goodness. There's been blood, sweat and tears getting that one up and running. So now you can actually reserve appointments online as well. So if you check out the link tree in the description, that'll take you through and you can actually reserve an appointment with myself, the lovely Mr. Taylor Green. This was a great one. I really enjoyed doing this one. We get just as excited about you guys as earwax removal. So this was actually loads of keratin and keratin ribbons, which are one of my favorite things to do. So you can see here we've got this grip on the outside edge. Look at this as it comes away.
Plenty of wiggling, yeah.
Look at that. Look at that unravel. What's this, Taylor Green? You're going to like this one. Oh, hang on. I've got to get the forceps on it.
Yeah.
Watch this coming out now. You ready? Look at that.
Don't break away.
It didn't. Look.
Wow.
All the way out.
Wow.
That was great. I love those ones too. They're so much fun to take away from people's ear canals.
Especially when it all comes up in one go.
Exactly. We saw this. I thought, is it going to come away cleanly? But watch this coming away as well. This is a nice one. This is actually just a little bit of keratin that's accumulated on the outer portion of the ear canal. But out that comes
Good job, David.
Thank you very much. Thank you very much. I enjoyed that one. Yeah.
Oh, look at that.
Look at that squeaky clean that is. Yeah.
Wouldn't have known anything.
That, you run your finger like, like actually that clean. That's Taylor Green. This is actually a little bit of keratin coming through as well on this side. So very similar here. Make sure you stay tuned for the last one, guys. I want to know what you think this is. Don't cheat. Let me know in the comments what you think that white plug is that we showed you at the beginning of the video. Pop it into the comments now. Don't watch the video first because we do tell you what it is. Look at this coming away. Look, lovely keratin ribbons on this one. This was so lovely.
It's been a long time since I've had a really good one.
I haven't had one for ages.
It's been a long. I had one that started unfolding like this the other day, but it was just breaking off in little pieces.
Now, see, that one did break. Now, I thought that was going to come away a bit like the other side, but it did break. But let's have a little look at this coming away. There we go. You can see, give this a bit of a wiggle up and down, just loosening that keratin. Yeah. So the reason the keratin's there, guys, this is actually your canal wall skin that should break away and come away and get mixed with the wax and fall out of the ear canal, but sometimes it doesn't and it dries, and this is what happens to it here. Yeah. Now I've opted to put the Jobson horn on top of this just because I don't want to peel this and it to go all the way down the canal into the fresh skin. So I'm just taking this away with the Jobson horn on the outside edge, and there we are. Look at that. Make sure you stay tuned for the ruler shot.
Steep ear canal as well. Dude, look at
Boosh! Look at that. 6.5, or just over 6.5 centimeters.
Yeah. What was that?
Hang on, 2.5 inches. I'm gonna go with that one. There we are, guys. Guys, we kind of had a chat about. Oh, hang on. This I'll come back to that. You can see this white plug here. What do you think this is? Last chance now, guys, to get it into the comment section. What do you think this is? I'll give you a little bit of background to this patient as well. So this lovely lady came through feeling super duper blocked up on this side. Now, there is quite a lot of history of ear, nose and throat problems, loads of ear infections, loads of sort of eczema and psoriasis in the ear canals, lots of itching, lots of pain. So when we actually started to take this away, it looked quite fibrous. Now, I didn't know whether this was lots of dry skin and that maybe the patient had used a cotton bud just on the outside edge, which is what the fiber was. But look at this coming away, and this was wet. So look at that. What do you think that is? Last chance, guys. Yeah. It was actually a big plug of cotton wool. Patient's been using cotton wool to stop, but look at, sorry, I keep getting distracted. I'm going to come back to all these points. This is a load of dead skin that's been sitting down on the eardrum itself. Look at that coming away, trapped behind the cotton wool plug. Right. Let's go back to the cotton wool plug. The reason the patient had used it, because they suffered so much with eczema and ear infections, they've been advised to keep their ears dry. So they've been using a cotton wool ball with Vaseline on and putting that on the outside part of the ear canal. Now, some of that's obviously inadvertently gone down inside, and that's the reason for that. The reason the skin hasn't migrated off here, it's been trapped behind that plug. So the epithelial migration just can't happen. And you complicate matters with the fact the patient has some psoriasis and some eczema as well.
It sounds really silly as well, but some people actually forget they've put the cotton wool
in.
They
do, yeah.
And they put another one in on top, and that's just what pushes it in further.
So easily done.
And,
what was the one video we had on here? Was that something like 12 or 13 cotton wool balls we took out of somebody's ear canal?
That was yours.
It was mine, yeah. That was good for you. That was pre-Taylor Green. That's how long ago that was. That was pre-Taylor Green. But we're just taking these lots of bits of dead skin. Now, I know somebody's going to say, well, okay, yeah, it doesn't look particularly clean. It's not going to. And this patient's ear canals are very, very tender. The reason we're not irrigating, so we'd normally irrigate to get these bits off, is because the patient suffers a lot with ear infections and, you know, and psoriasis as well. So irrigation is not a great idea. Well, all we're going to do there is get the ear really wet, and it's just going to trigger another infection. So I've cleared this up as much as I can. With the cotton wool ball gone, it means that epithelial migration can kick back in, and it's going to take that off the eardrum there as well.
It's quite a hefty amount, actually.
There was a chunk, wasn't it?
A big old piece in there.
7/8 of an inch. So what's that in centimetres?
Just over 2 centimetres.
Just over 2 centimetres. Yeah. Right. I kept saying I'll go back to that. One thing I did want to say, guys, we kind of had a chat about the channel and stuff like that, and then we did start throwing a lot of medical terminology in there. But I think we will still keep doing that, but I think we like to have a bit of a laugh and a joke about earwax removal. It is a really serious subject, but you don't have to present it so seriously, and I think that that's the way we enjoy presenting things. So I think for us, we enjoy what we do, and we might laugh and joke about it at the time, but that's just our personalities and that's just the way we go. So that's the way we're going to move forward with the channel. We're going to keep it doing that way. We will throw some more medical terminology in there for you and explain things as we go along. But we like to keep things simple because I think it just makes it more accessible for everybody.
We'll give you a little treat every now and then.
Yeah, we'll throw a couple in. We have got one coming up. I think it might be next video. But anyway, I won't spoil that one for you guys. But as always, thank you so much for watching our video again today, guys. Don't forget to check out the link tree if you want an appointment with myself. The lovely Mr. Taylor Green. You can actually reserve one online. And as always, take care of yourself.
Take care of your ears.
And take care of one another. And we shall see you for the next video. Bye, everyone.
Bye.